I love allergy immunology just because you get to deal with a whole range of ages and patients. You get to be a generalist, but also a subspecialist. We get to deal with so many health challenges that affect children and adults. We get to work with conditions that affect skin issues, digestive issues, nutritional issues, pulmonary issues, and we really get to make an impact on somebody's quality of life. We're a relatively new fellowship program, both at IU and in the context of allergy fellowships across the country. I think the fact that we're one of the younger fellowship programs is a huge asset to us. It allows us to be flexible. It allows us to change learning schedules and patterns based on what meets the needs of the fellows, but also in conjunction with what is going on in terms of understanding.
We really want to make sure that they get a good experience of the breadth of our specialty and understand that there's a lot of different ways that they can go into their careers and try to get them that exposure while they're here. We have 2 years in our program. Our first year is a little bit more focused on clinical experience and exposure, and then our second year is really not that different, but there's a little extra research time built in so that fellows can sort of work on projects, get papers written, posters done, have some experience sort of outside with other subspecialty areas with elective rotations. And so we try to provide that sort of big range of experiences while people are here.
Indianapolis is also a fascinating city to live in. It's a very interesting city, and there are many opportunities for a young person to learn and develop and also have a great quality of life. Our fellows are trained in at least 3 primary locations. One is Riley Hospital for Children downtown, and also at Methodist Hospital, and then also at IU North in Carmel. And they get to see predominantly children at Riley, almost all adults at Methodist, and a combination of adults and kids over at IU North.
I think my favorite thing about our program is the diversity in our patient population. From different socioeconomic classes, we go to a lot of different hospitals in different areas in the greater Indianapolis area, and so you get a pretty wide exposure to the different types of patients that we'll encounter when we're done with our training.
We really see patients all across the whole spectrum, from the simplest, most straightforward allergy cases all the way up to the most complex immunology cases, and we have good collaborations with a lot of the other subspecialty areas that we need to work with to take care of the most complex patients. So I think that huge breadth of opportunities to learn is really what sets us apart.
A lot of training involves what are considered allergic conditions, and then we also deal with a lot of immune deficiency issues. Our fellows get a ton of experience doing food challenges, and that is something that is very, very valuable in practice, whether it's clinical practice, academic practice, research practice. We get a lot of exposure to doing food challenges. Our program tries to figure out what each fellow's interests are, figure out where their passion lies, and help them develop both a learning schedule, and learning curriculum, and a research project that they're interested in. We do have the opportunity for a T32 program here that does allow people, if they want to pursue a 3rd year of training and focus a lot of that on research, they certainly can do that, so that opportunity is there.
If a fellow's really interested in pursuing a research-heavy career, we actually have a lot of great opportunities. There are great mentors here who run their own lab and have tons of experience doing that. There are grant writing workshops through the CTSI. We have multiple streams of funding. There's a lot of different opportunities, I think, to navigate some of the complexities that are out there right now. And I really think this is a great place to learn those skills if people are really interested.
I think we are a smaller program, but I think because of that, we have the ability to tailor things the way we like it. We can give feedback on how things are going, and things will change according to what we say. And if we're more interested in this particular clinic, we can go to that clinic more. And I just feel like we get a lot of individualized attention because it's a smaller program.
Our goal is to really have our fellows have options and to have choices and be able to do what they're interested in doing when they finish their training.
I think we are a really cohesive team. The fellows we've had, been very lucky to meet really great folks who've come through. They've gone on to enjoy successful early careers, And so that's really what drew me here in the first place. And I think it's just over time I've been really pleased that that's continued to be a really good source of positive thoughts and feelings.
We love working with the fellows. It really is very much a joy to work with younger learners and see how they change in their understanding and see what happens to them even after they graduate.